When you look at something like this, the first thing that really hits you between your eyes is these single cell patterns. The cells are very discohesive. So they are not really clamoring on each other as you see in the follicular cell-derived tumors. And they have this very round nuclei. And on the bottom right of my screen, you see the cells have very round nuclei, and the cell nucleus is kind of pushed to the edge of the cell. And that is kind of reminiscent of what you see on plasma cells. So if you remember your medical training, when you're looking at the blood smears and you look at the plasma cells, the nucleus was always pushed to the edge of it. So that's called the plasmacytoid appearance. Plus, when you look at the chromatin, it has this very kind of even distribution of U and heterochromatin. So it's a dark and white spots, and that's called like a salt and pepper chromatin, which is very typical for tumors with neuroendocrine differentiation. So you see these tumors, this chromatin in carcinoids and small cell carcinoma of the lung. So that when you have this, I think 99% of the time it is going to be medullary. But for cytology point of view, because this is much more of a serious diagnosis that you're making, it's always good to either, if you do not have a good cell block, to do immunostains to get a serum calcitonin levels to really confirm it. And also now you can send a part of the aspirate for calcitonin level determination. So this is actually a very classic picture of what is called the epithelioid type of medullary carcinoma, which is the most common cell pattern.
And Zubair, can I ask you, like on the bottom here, it says spindle cell. And spindle cell to a lot of us always means anaplastic and rings the bells. Can you say a little bit about that spindle cell? And
so the spindle cell medullary, which is very interesting because when you see the spindle cells, naturally spindle cell means in the thyroid, anaplastic carcinoma, or a metastasis from a sarcoma to somewhere else in the body, or even a thyroid primary sarcoma. In a younger age or middle age group, you're going to see another tumor, which is called saddle, which the tumor has thymic type differentiation, and that can also have a spindle cells. But what will be missing is the marked nuclear pleomorphism, really abnormal nuclei. You don't need a pathology residency. You look at those cells and you say, that cell looks bad. So anaplastic carcinoma will have that. Plus you will have necrotic background because most of these giant anaplastic carcinomas will have necrosis in the background. And sometimes you can even see mitosis. So that it will be missing in that spindle. So it's a clean spindle cells because necrosis is it's not that common in medullary. You do see it, but not that common on FNA specimens.